Hello, everyone. Welcome to this live session. Welcome, everyone. You're welcome to this powerful session, the Prostate Health Awareness Webinar. You're welcome to this session. My name is Dorcas Oguche, and I'm the lead coach at the Men's Health Research Hub. You're welcome to this powerful session. I'm excited to have you all here tonight. You're all welcome to this session tonight. Hello, everyone. Welcome to this wonderful session tonight. You're welcome to the Prostate Health Awareness session. You're welcome here. That's Oguche, and I am the lead coach at the Men's Health Research Hub. I am excited to have you all here tonight. It is my pleasure, and I am glad to have you all here tonight. This night we're going to talk about a very powerful topic that every man has to listen to. Every man has to be aware of what is going on in their health, to know about their prostate health, every of the warning signs, preventive measures, strategies, and actions to take concerning their prostate health. So I am glad to have you here tonight, and this night be sure that you're going to go home with you and you're going to have a turnaround in your health. Thank you for creating time to join us here tonight. It is a great privilege, and tonight you're going to get value. So please, if you are watching us, you can please share the link for other men to join us, because tonight there's so much value you're going to get, and it will be very important that other men also are able to partake of this wonderful session tonight. You can share the live session, you can share the link, and we're promising that this night is going to be a very good and great night. So this night we're going to learn about our prostate health as men. You're going to learn what your prostate gland does, what it is. You're going to learn about the warning symptoms, warning signs, things to watch out for, things to take note of, and even preventive measures, things you have to do, what are you supposed to do, what are you not supposed to do for the benefit of your prostate health. All these is what we're going to look at tonight in details. So this is a call for you to stay on. Do not miss any session of this live, because you're going to get so much value. You do not want to miss any part, because every part is very valuable and crucial for your health. Going right into the session, we already have our host here waiting already. We're going to hand over the mic to her. Our guest speaker today she's my mentor, and in Abuja here, she's literally my mother and everything. I'm glad that I met her. She has been so much to me. She has been in the wellness space for over 25 years, and she has worked with over a 1,000 men that I'm very sure of, and with so much experience, life experience, and conversations with people from tonight's session, I'm sure you're going to get value. So I'm handing over the mic to her now. Ma, it is your time. Thank you so much, Ma.
Good evening, everybody. Thank you for joining us tonight. We're having this echo, and then but I think is it clear? All right. Everybody wants that you also take care of everything, but a lot of times you forget that this is just a call to remind you to also love yourself. So, welcome to tonight's meeting. And in the last 5 years, we've had figures that is causing us to want to talk to the men. The statistics are no more friendly as far as men are concerned. 52% of men have high blood pressure, 12% of men, or even more, have diabetes. And so when you talk about prostate issues, almost every man that is over 40 is battling prostate issue. And that is a challenge. And that's what we want to look at tonight. So when we create the awareness, it's easier for you to know what to do, what to stop, the new habits to take on. And that's what we are here to do tonight. So welcome to all our men joining us from all over Nigeria, from outside Nigeria, wherever you're joining us from, and even when you're watching a replay of this, we welcome you. If you're a man over 40 in Nigeria and you have not thought about your prostate, tonight changes that. Tonight changes that. So, how many of us men know someone affected by prostate issues? Please type in the chat room. Let us even know where you are joining us from, and then give us a feedback. How much do you know about prostate? How much do you know about prostate? You need to let us know. I want to have an idea of what do you know, because for all you care, some men don't even know where their prostate is. So what do you know about the prostate? How many people do you know that have issues with their prostate? So those are the things we will look at tonight. What exactly is the prostate gland, and what are the issues? What are the things that can go wrong with the prostate gland? So how can we prevent, how can we manage for those who really have issues with it, and then how can we avoid excuse me, avoid the complications when it is not diagnosed on time, detected on time, or when it is not well managed? Those are the things we want to know. So if I say know your enemy, you may be thinking, is my prostate my enemy? Is a plumbing work put together by God. And honestly, to give you a simple anatomy, is the size of a walnut. I don't know if you know what they call a walnut. It's, is it a fruit or a vegetable? Walnut is very small. It's round. Is round. It has a black outer casing. It's just round like that. Two in every man. It is there since you are young, but at 40, it begins to enlarge by itself. So it is when the enlargement is not controlled that it begins to have issues. And then when it becomes cancerous, then there is problem. So three things can go wrong. We will be talking about those things. So it's a small organ, but it has big consequences when ignored. Small organ, but has big consequences when ignored. Meaning there is a need for every man to be aware of the prostate and what can go wrong with it. So what are the functions of the prostate glands? There are two in every man. One, urine flow, and two, sexual function, three, hormonal balance. Simple so that you will understand what we're talking about. So it's the size of a walnut, so imagine how small it is, but it can have big consequences when not properly handled. The functions: urine flow, sexual function, hormonal balance, and then why it becomes a problem after age 40. You will notice that we always talk about that age 40. When a man clocks 40, the first thing to become aware of is the prostate gland. So, in Nigeria, particularly, or amongst black men generally, there is a late diagnosis culture. When people begin to see the signs and symptoms of these challenges, they neglect it. They're a bit nonchalant. We're used to waiting until something becomes an emergency. That's when we go to the hospital. We like what we call the fire brigade approach. That's when we will now start hustling and running. Why wait until then? So, this guy is brought up to be strong. The parents will say, "You are a boy, don't cry. Boys don't cry. Boys don't do this." And so he, feels macho. He does not want to be vulnerable. He does not even want to tell his wife what he is going through. So we always counsel women to be observant about their husband so that we can help them. So don't just say I'm fine. Don't just say that. Please be vulnerable, open up if you are beginning to observe the signs and symptoms. Prostate cancer is the number one cancer killer amongst black men, not just Nigerian men. Maybe it's a genetic issue, but it has become the number one cancer that is killing men. So, three things can happen to the prostate gland. We will talk about that. So, please recognize these signs and don't ignore them. Early warning symptoms: frequent urination, especially at night. We call it nocturia. Have you observed how many times do you now urinate overnight? One, it will disturb your sleep. So it means that the body will not have adequate rest. So you need to begin to, if you used to wake up maybe two times before, and now it is 4 or 5 times, then something is happening. And then there will be a weak stream, or interrupted urine stream. Yes, your bladder is full and you want to pass urine, but it is intermittent. It will go, it will stop, it will go, it will stop. Even at the beginning is weak. Instead of a strong come out again, it is stop because the sphincter is weak. That's there are two. There's the inner one, there's the outer one that controls the tip of the bladder. You see, this plumbing comes from all the kidneys, the urethra, the ureter, the ureters, the urethra, all of them are together. So once there is an issue, once there's an enlargement of the prostate gland, there's a pressure on the urethra. The urethra is that tube that comes out in the male reproductive organ, which we call the penis. Urine comes from that urethra. The sperm also comes from that urethra. Now, the two glands, the prostate glands, are like balls surrounding the urethra. The urethra passes in between. So when there's enlargement of the prostate gland, there's a pressure on the urethra. So urination becomes painful and then difficult to pass through. So there can be burning sensation when urinating. You want to urinate, but that burning makes you want to stop. And then there may be blood in the urine or in the semen. The semen is when you ejaculate into the woman. And when she's cleaning, she can see blood in that semen. So we say there's blood in the sperm. Most people call it sperm, but it's actually called semen. That fluid that carries the sperm is called semen. So when there is blood there is one of the symptoms, of prostate issue. So what are the advanced warning signs? Pelvic, hip, or lower back pain. The whole area becomes painful because there is enlargement. And one thing that affects every other thing, erectile dysfunction. That's when some men begin to speak. When it now affects their sex life, they now feel, mi le ṣọmọkùnrin. That is when it hits them because a man feels incapable when he cannot perform well on the bed. Unexplained weight loss and fatigue, tiredness. Any little thing you feel worn out, you're tired, and you'll be wondering how much work have I done that I'm feeling this tired. And then silence. Pamora. You don't talk.
Okay, it's like we're having network issues. Okay, she's back now. All right, ma.
Thank you. Sorry. So, God has given the doctors, the medical team, the wisdom to understand how the body should function. And if anything goes wrong, they know exactly what to do. So, please don't neglect that. Don't. We need every information that we need, we should have, that will guide us to know the right decision to take per time. So we want to break that cycle of silence. Sir, speak out. Don't just die in silence. Speak out. So it's important. If you are experiencing any of these symptoms, please type in the chat room. You can drop your questions in the chat room and we will guide you on what to do next. The big 5 risk factors to the Nigerian men. 1. Age. Risk doubles after 40. It spikes after 50. So as we are aging, all the body organs are also aging. So there's a need to rejuvenate these organs as we, when you use something every day, it also becomes weak. So the risk doubles after 40. That's age. Race. Black men have the highest global risk. That's why I said when we started that it's also kind of genetic. It happens more. And that's why it is not the whites that will help us find solution. We have to be intentional in helping our men fight this scourge. Family history. Father or brother with prostate issues, that doubles your risk. The reason is simple. You grow up living the same lifestyle that your father and brothers change. There's a possibility of having the same challenge. So that's family history. Diets. What are you eating? What are you eating? High intake of red meat. A lot of men eat pepper soup. I mean, meat pepper soup. They eat suya, processed foods, and low vegetable. The average black man is looking for heavy swallow, looking for carbohydrates, because that is what he thinks will give him energy. Sir, the kind of energy you need today is no more that physical energy. In the olden days, our grandparents and parents, they were farmers. They needed that heavy swallow for physical energy. Today, you need to build men are busy in the offices. You resume by 8 or 9 and you are there till 5, 6. So that sedentary life impedes digestion. It disturbs the normal flow of blood. So you need to be standing up even when you are walking. Set an alarm to remind yourself of when to stand up. So stress. Most men have learned to live with stress instead of learning the natural ways to manage stress. So alcohol, smoking, all of those things contribute to the occurrence of prostate issues. The Lagos Abuja Warri Port Harcourt busy man profile. You sit in traffic 3 to 5 hours daily. That is not healthy. You skip meals. Sometimes you eat very late because by the time you come back to the house it's about 8, 9, and that's the only meal you may be eating in the house, and you don't want to offend your wife, so you will eat it no matter how heavy. Sir, we will need to adjust that from now. High stress, whether corporate or entrepreneurial life, whether you're a businessman, a politician, or a management busy management executive, that's high stress. You're mentally stressed and it affects the body. Most of these diseases we're talking about are psychosomatic, meaning they are of psychological origin but they manifest physically. And then you are so busy, you don't have time for medical checkups. There is somebody that I'm supposed to coach, he's in Port Harcourt. But can you imagine him telling me, madam, it's serious, so time? I said, sir, your body must be secure to deliver on your vision. Your health is your first wealth. Your health is your first wealth. So please ensure that the body, your suit, your body is your physical suit. That's what you connect this physical world with. No matter how strong your spirit is, no matter how strong your mind is, that is, your mentally, you are very intelligent and good at what you do. If the body is, that's the end of the vision. So it's important that you create the time for medical checkups. Get your diary and write it there. And then when you say, I'll go when I retire, that may be too late. Death may come even before retirement. You don't want that to be your case. So please get a physical diary and indicate when you should do your medical checkup. Get the appointment first to remind you so that you will do well to yourself. Prevention, what you can start new habits. There's a book called Compounding Effect, and also there's another book called the Atomic Habits. What you do every day will determine where you will end up. So I don't know what your vision for your life is. I'd love to ask a question. At 60, will you be a liability or an asset? If you're going to be an asset from 60 into retirement years, the journey starts. It starts tonight from your mindset. You need to, you need to adjust your thinking, your thought process towards good health. It's important that you do that. So eat more of tomatoes, that red tomatoes. It contains lycopene. Lycopene is a powerful antioxidant that helps in prostate issues. But please tell my antioxidant specifically working for the prostate gland. Eat lots of watermelon. The redness, the redness. Watermelon can serve as your breakfast. It's alkaline and it is not cooked. It is fresh. So just dice it, remove the. You can just even make it into a watermelon juice and drink in the morning, just like you can drink your tomato juice. Pumpkin seeds, that's ugu, can be used in your vegetable soup and it can be added to salads. Soy and beans, plant-based protein, they are better than the animal sourced protein. So you want to do soy, you want to do beans. Freshwater fish with scale. Freshwater fish with scale. Please avoid fish without scale. Those ones retain toxins on the skin. If you must eat things like catfish, please remove the skin. So, food eating is important. Please take lots of fruits and vegetables. If you are eating rice like ofada rice, you can add vegetable soup, you can add salad to it. So you need to eat lots of vegetables. If you are eating amala or you are eating pounded yam, please eat small swallow with lots of vegetable soup. Eat less of imported rice, less of imported rice, less of suya and red meat, less of suya and red meat, less of fried foods because that does not digest on time. Anything that will slow down digestion, please avoid it. Avoid excess alcohol. If you love yourself, avoid alcohol at all. Men love to ask me these questions. Madam, what do you think about drinking alcohol? I said, sir, even within you, in your conscience, in your spirit, you know you should avoid it. If you choose to drink it, please understand the consequences and be ready for it. Refined carbs, I've mentioned the white imported rice, avoid, reduce cassava. Tubers are good, the yam, the cocoa yam, the potato, the Irish and the sweet potato. Boil them. Please avoid frying. Boil them, eat them with garden egg sauce, vegetable sauce, fish sauce. You can eat them with that. So they're very good. Dairy, avoid or reduce dairy products like milk. Reduce dairy products like milk. Remove sugar from your diet. So that white table sugar, please remove it or reduce it to the barest minimum, and then avoid sugary drinks. The man won't also need all of that. Today, we have a lot of men, because they have hypertension, they are also developing diabetes, because those two diseases affect the blood vessels, the walls of the blood vessels, and in turn it will affect the heart. So you find out that the whole body is a system, or the body, in biology or anatomy we say we have the circulatory system, the nervous system, the respiratory system. All these systems make up your body. If one is defaulting, it affects every other thing because they work hand in hand and together. So practical tips like we're talking about: add tomato, fresh tomato, to your meal. Please exercise 30 minutes every day in the morning. You need it to move and shake the water in your body to aid proper blood circulation. As a man, you're very busy and stressed. You need to increase blood supply to the brain. So it's important that we do that. Even within your estate, take a walk around minimally 4 times in a week. Sir, create the time. Nothing will stop if you are not there. Nothing. Everything will continue even without you. So please create time for yourself. Kegel exercises for the pelvic floor health. You can go on YouTube and Google Kegel, Kegel. It helps to strengthen the pelvic floor. That is the muscle surrounding the prostate gland. There are specific exercises for men in that area. So reduce prolonged sitting, set a timer, stand up every 90 minutes. And that's why you don't just live in a place that is far from your place of work. Sitting lunch, it will ensure that you walk. You need to move your body. We have about 65 to 70% of us is water. And in a lake, nothing lives in a lake. We need to move around and move the water inside of us. Hydration, sir, every day make sure you drink a minimum of 3 liters of water. The bottle of water you drink has measurements. This one I'm holding is 75 cl. Check the measurement on your own. 75 cl is 750 mils. 3 liters is 750 mils times 4. 1.5 cl is 1500 mils. So you need to know that's the minimum you should drink every. So please ensure you are properly hydrated. Reduce evening fluids to manage nocturia. I counsel people to stop drinking water by 6 p.m. Drink more water when you wake up in the morning, but by 6, stop drinking water so that it will not disturb your sleep, because one thing leads to another. If you have to wake up 3 4 times to go to urinate in the night, it disturbs your sleep. It disturbs your, and that means without adequate rest, the body cannot repair itself. So it's important that you do that. Sir, stress management. Oh, we need to manage stress. We go through stress every day. So the first thing is to identify the stressors. What are those things that can stress you? If it's a relationship, do away with it or manage it. Guard access to your mind. If you guard people's access to you, it will reduce the stress you have to handle. What about your work? Delegate as much as possible. Do only should do. Sir, don't leave generator behind your bedroom window, and please avoid putting a television in your bedroom. Listening to news as the last thing at night can disturb your sleep. So anything like that, chronic stress elevates cortisol and hormonal imbalance. You don't want to go that route. Practical tools: pray, meditate. Thinking is good. Journaling is good. Delegation. When you journal things, especially in the morning when you wake up, you want to be grateful. Journal your gratitude. Those things you want to do, your affirmations, write them out. There's a link between your wrist and your brain, and it helps because ideas of what to do will come to you. When you wake up in the morning, your brain works best between 4 a.m. and 7 a.m. So when you meditate around that time, when you study, when you pray, you are receiving inspiration from above, and that helps you. So deep breathing, deep breathing ensures that you take in enough oxygen to get oxygen around your body. That is the major food of the brain, and it is carried by the blood. So oxygen bonds with the hemoglobin content of the blood. You must ensure adequate supply to the brain to avoid mental fatigue. It's important that we do that. Answer your sleep hygiene. I know today is Friday. You want to go out with the boys. Sir, don't do that every day. Go home on time and rest. Your body needs the rest, your brain needs the rest. That will also help you to increase your productivity and increase your profitability. So don't just take it for granted. Your hustle is important, but a dead man cannot run his business. So I respect your hustle, sir. Oh, I respect your hustle. Organa master. It's good to be the man, but sir, you need a strong body to execute your vision. So a dead man cannot run his business. You don't want to be found in the grave. If you leave that platform, everything will continue. Many things continue. Cut the toxins. Cut the toxins. Toxic load causes the development of every sickness in the body. And that is what happens when a man has a distended tummy. That high level of testosterone adds to that development of the belly fat. So, apart from doing your exercises, you must also stop eating cooked meal after 6 p.m. and you must do your exercise consistently and rest well so that your body repairs itself when you are resting. Your tummy is one of the food there when it is not eating at the right time. So if you have been eating at 8 or 9 p.m., please I'll advise that you stop that. Will digest it when you are still sleeping, and because you are not burning it off at that time, it will create storage facilities. Your belly, I call it okeari, is one of the places where the body stores this excess that you have eaten. So cut the toxins, reduce alcohol, especially the ogogoro, the beer, the spirits. Quit smoking is a direct link to aggressive prostate cancer. It's a direct link. So if you already have symptoms, don't self-medicate. Please go to the hospital and don't just stop with a general practitioner. See an urologist. That's the physician in charge of kidney matters. because the prostate gland comes under the urinary tract. So see an urologist. Do the PSA, the prostate specific antigen. It's a simple blood test that every man that's over 40 should do every 6 months, because that's the earliest way to diagnose the prostate issue. Apart from the symptoms that you feel by yourself, it's widely available in most laboratories in Lagos, Abuja, Port Harcourt, Warri. You will see even in Kano. There's also a direct rectal examination to be carried out by the doctor. It's a bit uncomfortable, but it could save your life. That's a physical examination where the doctor will insert his finger from the anus to feel, practically feel or physically feel the prostate. It knows the normal size. So if it has enlarged, if any of the prostate glands have enlarged, the doctor will know. And then you can also do the ultrasound scan. It's affordable at most diagnostic center. It can be done to have an outline if there is growth. So three major things that can happen to the that can go wrong with the prostate gland. There can be just the enlarged prostate. That they do surgery in the hospital. We call it the BPH, the benign prostate hypertrophy. It is enlarged, but it is not cancerous. So it can be managed surgically. It's an invasive procedure, but it's manageable. Usually in 5 to 7 days, the patient can go home. Now there are even newer methodologies that it can be used and faster. There can be an inflammation, which we call the prostatitis. Is an inflammation or infection of the prostate gland. So with that, doctors will give you the antibiotics and anti-inflammatory drugs to manage that. The third one is the prostate cancer. Most times it has to be surgically managed. And then they still do chemotherapy, which is radiation. Then they can do hormone therapy. Outcomes are far better when decide that you want to be healthy. Choose health. Adjust your lifestyle, just like we have spoken tonight. And then the discipline to do. Build a support structure for yourself. And that includes your spouse, because she's going to help you with what you eat. Your physician is in that support structure. Your marriage counselor, because while you are going through this, it may have an effect on your sex life and your marriage. Get your business mentor or career mentor. If you're a career person, you must have mentors for every aspect of your life. It's important. Very, very important. Don't wait for a crisis. Make a decision tonight. Avoid complications. I love to talk about that. My mom was diagnosed to have diabetes when she was 49. I was 13. We nursed her for 3 years. She eventually developed high blood pressure and had a heart attack when she was 52. She died in my hands. I was 16 as a complication of diabetes. So every disease has complications when it is not properly managed. So what happens? Prostate matters. There can be retention, and that's when there has to be an emergency catheterization. It means that the bladder is full, there's urine there, but the urethra is blocked. Urine is not coming out. The doctor will have to forcefully insert catheter, which we generally call rubber, to drain the urine out. That is already an emergency. And so you find a lot of men having to carry this catheter for a while. Kidney damage from chronic blockade. Why? The urine is flowing back. It's flowing back. Instead of the urine coming out of the body, it's flowing back into the kidneys. And that can damage the kidney itself. because urine itself is acidic. So leaving it in the bladder for too long is already contradictory to nature. Naturally, as you produce urine, it drops into the bladder. So you feel pressed when the bladder is full. And so this urine, once the bladder is full, gives you a signal that you want need to expel the urine. But now because there's blockage, the urine is going flowing back. And that can harm the ureters, the urethra itself, and the kidneys. So you don't want that to happen. There can be sexual dysfunction, which can affect your relationship with your spouse, and it makes you feel less of a man, and it can be permanent if untreated. There can also be metastatic cancer, that is the spread of the cancerous cells from that gland to bone, spine, lymph nodes, and other places. And sir, there can be preventable death. Preventable death. So it affects the family because now it drains finances, your wife, your children, your business. They all need you. So if anything goes wrong with the man, it affects the whole system. It affects the community. They all need you alive and functional. So it's not just about you. So don't be selfish, sir. Consider all the other lives that are attached to you. So it's important. So live with this. The 40 plus Nigerian man's prostate pledge. Tell yourself, I will book a PSA test within the next 30 days. That's the first step. Please go for the test. At least know the state of your prostate gland. Add one prostate friendly food to your diet this week, like the fresh tomato, or you start taking watermelon as your breakfast if you are not diabetic. So, walk 30 minutes tomorrow morning. Tomorrow is Saturday. Start exercise. Go and play ball with the guys. Go to the field. Share this webinar with one man that you care about. Stop saying I'm fine. Get checked. So all of these are important. If you have questions, please type in the chat room. We will address them right away. At this point, I would also like to hand over back to our host. Real men don't just hustle. They don't just hustle hard. They live long enough to enjoy the harvest. That's a quote by me. And that's why we are taking up this to talk to men. Sir, take good care of yourself. Don't just hustle. That's not what you are all about. You must also take good care of yourself. Love yourself. We love you, sir. Have a good evening and nice weekend.
Wow, 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 wow. Thank you so much, Coach Fehintola Onogoruwa. Thank you so much. That was a very powerful session. And we'll take a few questions. If you have questions, you can leave your questions in the comment. You can drop your questions down while she's still here so she can answer some of our questions. So at the Men's Health Research Hub, we work with men to help them live longer, healthier, and stronger. So at the Men's Health Research Hub, we have a pack of combined products, nutritional supplements to aid men's health. And one of those nutritional supplements is the Forever Vitalized for Men. The Forever Vitalized for Men is a carefully curated supplement to aid men's prostate health, hormonal imbalance, and your hormones. This supplement is to aid you and your prostate health. While our guest was talking, she talked about removing toxins from your body. Inside of the men's reset pack, we have a supplement, the Forever Aloe Vera Gel, which is this bottle. This is the Forever Aloe Vera Gel. Forever aloe vera gel aids with detoxification. It helps you remove toxins from your body. And then we have the Vitalize and the Multimaca. The Vitalize. This is purely for prostate health. Once you get this supplement, it can help you get the appropriate nutrients that your prostate health requires. She mentioned some foods that we can eat, and inside of this, the appropriate amount of these nutrients that we require are in here already. So getting these aids with all of that. And then the last one is the Forever Multi Marker. When you're having prostate issues, there's likely going to be drop of erection. You're going to have low desires and all of that. This helps you to stay ahead of your game. So these three products are well packed for men's health. So you can send me a message after this, or you can leave a comment in the session, and then I will reach out to you. Thank you. Please, my phone number is 08064 500 833. If you need to reach me, my phone number again is 08064 500, that's 500 and 83. Thank you so much for staying with us in this live session. One of the take notes or few things you can take note or go home with is your lifestyle affects your health. Your health is your responsibility, and from today make a decision. Go for checkup, eat properly, and take care of your health. Exercise, drink more water, and you're good to go. Take care of your prostate, and your health will be better. Thank you for staying with us. Thank you for being part of this session. I'm glad you got value. Please subscribe to the channel. We post our videos weekly for men's health and general wellness. Thank you so much, and God bless. Well, if you have your questions, you can drop them in the comment section or reach out to me through my phone number 08064 500 833. Thank you, and God bless.